Thanks, dear viewers, for joining us on this edition of the newscast on Equinoxe Television, live from my headquarters in Cameroon's economic capital, Douala. I am Babla Jonathan. In our top stories in this edition of the news, guns continue talking in the two Anglophone regions of the Republic of Cameroon. The newly appointed divisional officer of Bafut in the northwest region is commissioned into his functions amid a tense gun battle between separatist fighters and elements of the National Armed Forces. Will be giving you details in this newscast with our correspondent Mbu Stella, who is on standby, and we'll also be talking about the coronavirus pandemic with the figures that are still increasing in the Republic of Cameroon, and government is enhancing measures to stop the spread of the coronavirus. The government officials in charge with the responsibility of evaluating and following up government's response to the COVID-19 pandemic were meeting a video conference chaired by Prime Minister Chief Dr. Joseph John Group in Yaoundé today. We begin this newscast in Bafut in the northwest region of the Republic of Cameroon. It is one of the localities in the heart of the 4-year-long armed conflict in the Anglophone parts of the Republic of Cameroon. The divisional officer of that municipality, recently appointed, has been commissioned into his functions amid a gun battle between separatist fighters and elements of the National Armed Forces. Mbu Stella reports. Stella with that report from the northwest region of the country, where guns have continued talking despite the call for a ceasefire by national and international right and human rights and non-governmental organizations. Political and civil society leaders have been calling for a ceasefire in the two Anglophone regions of the country, but the guns have continued talking, and a crackdown is on the way. A crackdown by military officers who are striving to put an end to the separatist activities in the two Anglophone regions of the country. In the meantime, the authorities in the nation's political capital, Yaoundé, who are in charge of reconstruction of the two Anglophone regions, notably the Minister Delegate, the Ministry of Economic Planning and Regional Development, Paul Tassong, and the former mayor of Kumbunjong, Donatus, now in the southwest region of the country, spearheading efforts to pave the way for the reconstruction of parts of the two Anglophone regions of the country destroyed by the 4-year-long Anglophone crisis. Mbustela reports on Bamenda. Of Limbe in the southwest region of the country, where correspondent Davison Maimo takes a look at the impact of the crisis on small business activities and government's efforts to revamp business and help the business persons to survive in the midst of the crisis coupled with the coronavirus pandemic. His report.
To the ongoing Anglophone crisis, the small and medium-sized enterprise is among the most hit sector in the two Anglophone regions of Cameroon. The handicraft and local food processing enterprise are barely limping, since 90% of the raw material used is from the forest, which is a no-go area for over 3 years, for fear of being attacked, kidnapped or killed.
The Southwest has suffered from insecurity first. They were a little bit confused, they were a little bit displaced. If there were no instability, we think that their businesses would have grown faster than what they are now.
Visitors and tourists that greatly contribute to the purchasing power of this sector has also dropped, coupled with the global health crisis caused by the coronavirus pandemic.
The COVID-19 also came, and so the small enterprises that are here are actually in very low morale.
It is in this regard that the government of Cameroon, through the Small and Medium-Sized Enterprise Promotion Agency, recently awarded vouchers and accreditation to some small business persons operating in the agricultural and agro-food processing enterprises, all in a bid to boost their morale. Speaking during the ceremony, the director of the agency said the Business Development Service have been empowered to help the agency formalize small agricultural and agro-processing enterprises.
The state and the French Development Agency are committed through the 10th edition of development contract its support for SME promotion agency.
Presiding at the event, the first Assistant Senior Divisional Officer for FACO said the agricultural and agro-food transformation is an important sector of the state.
Agricultural and food processing enterprises appear as an important tool for growth, taking cognizance of the fact that their potential still remains under exploitation.
Everything being equal, the project can only yield fruit if there is total ceasefire for things to go back to normalcy, so that farmers and craftsmen can go back to the forest and a peaceful business climate re-established.
We remain in the northwest region. We go back to the northwest region of the country to talk about some 6 soldiers who have been raised to higher ranks, and they received epaulets corresponding to their new ranks today in the town of Bamenda. Bustela files in details. Stella with that report from Bamenda on the Epaulet Award ceremony that took place in the town of Bamenda today, and 6 soldiers were this Wednesday raised to higher ranks, and they were awarded epaulets corresponding to their new ranks. This ceremony took place at the 51st command, command of the and support battalion, the 51st command and support battalion, and correspondent Bustela was there. She now files in details. Coronavirus pandemic. Cameroon is now counting 13,711 persons tested positive for coronavirus, 11,114 cured, and 328 dead, and the fatality rate stands at 2.3%. These figures emerged from the weekly meeting of the Inter-Ministerial Committee to evaluate and follow up government's COVID-19 response. And another issue that was on the discussion table during the meeting today is the contribution of African traditional medicine to the fight against coronavirus. And the Minister of Scientific Research and Innovation said that studies are well on course, and 100 medicinal plants have already been identified for that purpose. And government is also fast-tracking the repatriation of Cameroonians blocked abroad because of the coronavirus pandemic. 284 have already been brought back home, and 701 are still stranded abroad. 162 are expected to arrive the country through the Yaoundé-Simalé International Airport later today, and through the Yaoundé-Simalé International Airport they will be arriving later today. And the government of Cameroon is also considering the reopening of its borders during the weekly interministerial meeting to evaluate and follow up government's response to the COVID-19. The government officials examined the measures being put in place within the framework of the international flight protocol concerning the decision of the European Union to exclude Cameroonians from the list of those authorized to travel to member countries. Steps are being taken for Cameroon's situation to be reconsidered as far as international travel is concerned. Back to Bafut in the northwest region of the country. I told you at the beginning of this newscast that the installation of the recently appointed divisional officer of that administrative unit took place amid tight security and a gun battle between separatist fighters and elements of the National Armed Forces. Stella reports.
From a distance away from the ceremonial ground, gunmen believed to be the separatist fighters fired at the convoy of Mr. Simon Emimo, Senior Divisional Officer for Mezam, as he moves to Bafut for a state duty. The soldiers on the ground had been on the alert. Bafut is one of the areas in the northwest region where the separatist fighters have been battling with elements of Cameroon's defense force. The soldiers pushed back the attackers and Mr. Diobe Elumba Didakos Elumba installed at the premises of his office in Bafut.
Dear population of Bafut subdivision, here is your divisional officer, Mr. Diobe Elumba Didakos Elumba. Take command.
Before the crisis started in 2016, the subdivision was one of the producers of rice, ginger, among other crops. Close to 4 years later, production has decreased.
There has been a mass exodus of indigents to other safer regions of the country and has hampered economic growth in this municipality. Many activities stood to a standstill, with some completely abandoned. The socio-cultural infrastructures, even though limited, are dilapidating, as stakeholders cannot access such structures due to fear of the unknown. Schools are yet to commence in this part of the division, as indigents still live in fear. We look forward to a brighter days when the indigents of Bafut subdivision will be free to go about their activities in a peaceful environment.
For Bafut to regain normal life, Honorable Oliver Ago, Member of Parliament for Bafut Tuba, prescribes.
We are using this ceremony to call on the population of Bafut that they should remain committed, law-abiding, respecting state institutions, and making sure that we should support the new deal who are just coming today. The security of Bafut is in the hands of Bafut people. So I think that we should give peace a chance, so that we can be able to carry on so many projects that the mayor has announced. We can be able to benefit from the presidential reconstruction plan.
Mr. Diobe Elumba Didakos Elumba will, among other duties, ensure the security of the population, their property, and the respect of the barrier measures to fight the spread of the coronavirus.
15 officers coming back from the southwest region of the Republic of Cameroon after a 3-year-long mission within the context of the Anglophone crisis have been congratulated by the top military officials of the littoral region of the country. They were received today by General Colonel Bikele Eme, who is the commander of the Legion commander for littoral region, and of course he also presided at the ceremony during which he awarded epaulets to some meritorious officers, raising them to higher ranks. Smanjik and Gabriel reports.
After the end of their training in 2017, the student gendarmes were immediately sent to the Legion office in the southwest region, where they were later sent to the battlefield against separatist fighters. Their stay in the southwest region was supposed to be for 3 years and rotatory every after 3 months. After their stay in the southwest region, 6 female and 9 male gendarmes who returned have been honored by the commander of the Legion office in Douala with high instructions coming from Yaoundé.
We are proud to welcome them. We wish to congratulate warmly those young girls and boys because of their commitment in the battlefield, and we are sure that the experience gained will help them to be more and more efficient in the ground.
Without any experience, when they were sent to the battlefield, the student officers say they have now acquired enough knowledge on how to defend their country.
My experiences there were not that easy, especially we those that are in the southwest. We were always being recognized everywhere. But with the measures that the hierarchy put in place, we were able to go there and came back safely. To those of our friends that did not make it back to their various homes, may their soul rest in perfect peace. All what we have learned there, I believe with my colleagues, we are going to apply it here. And may the Lord Almighty God continue to protect us no matter wheresoever we find ourselves, because there are dangers everywhere, even here in Douala. That is why I'm advising every of my colleagues that wheresoever they are, they should be careful.
They would definitely want to follow in the footsteps of their bigger colleagues who were recognized by the head of the Armed Forces July 1, 2020. Captain Alkana Fosop is now the Chief of Squadron. Meanwhile, Adjutant Gidela Besolo, Zambo Atangana, and Alega Patricia were promoted to the grade of Sub-Lieutenant. And Field Marshal Ndong Saki is now an adjutant.
Coming up, for me, Armstrong Sander paints the horrible picture of the Mekumu Health Center in the south region of Cameroon.
Situated some 20 kilometers on the border between Kiosi and Lemze subdivisions in the south region of the Republic of Cameroon is the Mekumu Integrated Health Center, whose image at first sight leaves nothing to desire. At an establishing view, the structure looks like an abandoned building, but no, the center served as a polling station in the February 9, 2020 twin elections in Cameroon. Sad enough, the one-day occupants left immediately after getting their vote, leaving the health center in its dilapidated state.
Bienvenue au centre de santé intégré de Mokomo.
Accompanied by the head of this center, we confirmed an initial opinion that this miserable structure could be a health unit.
Le centre était d'abord abandonné.
According to Augustin Vondo, chief of the center, the health unit was abandoned several years in the bush, and when he came, no equipment could be found in. Everything had been stolen.
Les gens sont venus casser les portes et ramasser le petit matériel qui était avant.
Without fear of contradiction, every visitor to this site will confirm that the Integrated Health Center has nothing. The head of the center, the lone staff here battles with very limited resources to relieve the pains of the local villagers. Without water, electricity and hospitalization beds, the Mekumu Integrated Health Center is not better than nothing.
Si par exemple il y a un cas ici,
villagers say their sick persons are instead taken several kilometers away to Kiosi for better medical care.
Le fait de rester dans le noir.
The head of the health center on his part resort to the use of bush lamps anytime an emergency case arrives at night. But when the cases are many, he is left with no choice than to leave others at the mercy of nature. With a hospital unable to handle their health problems, the local population, villagers, are forced to turn to natural concoctions for health, despite the risk involved. The vulnerable people have also been pushed into the hands of illicit drug vendors who have become health experts to a population abandoned by public officials. In the course of our investigation, we met with the outgoing mayor of Kiosi, who argued that the Mekumu Integrated Health Center has been abandoned by public officials. He says the 2020 municipal budgets for the Kiosi Council budgeted a huge chunk for the rehabilitation of the health unit, but the health structure is yet to receive a dime this far. Augustin Vondo says he has met several demands, including the request for a solar unit, additional health personnel, the rehabilitation of the leaking roofs of the health unit, and the provision of boreholes for portable water, and nothing so far has been made. At the heart of the fight against COVID-19 in Cameroon, the health center is unable to offer the minimum to the local population, and all efforts of the head of the center have been hitting the rock.
Class 6 pupils in the Mungo and Nun divisions in the Littoral and the West regions of the Republic of Cameroon respectively take on the common entrance examination amid the coronavirus threat, and teachers, school officials made sure that anti-COVID-19 measures were strictly respected by the pupils. Immaculate Fogwe.
Class 6 pupils in different primary schools in Cameroon sitting in for their common entrance examination. In some centers in the Mungo Division, Littoral region, pupils could be seen writing their exams respecting COVID-19 measures such as the wearing of face mask and social distancing. Pupils who did not wear their face mask were asked to rush back home and collect it in order to be allowed in the examination hall. They sent me out of the hall because I do not have a face mask. I forgot my face mask because I was in a haste. Candidates were also called upon to remain in their classrooms during their break period. While leaving the house, my parents gave me money so I could buy food from the canteen, but it was closed. Despite the fact that I was hungry, I wrote my exams well. I am excited because I know that I will succeed. School authorities blame some parents for not respecting the measures they gave.
S'agissant du déjeuner, nous leur avons dit que avec le contexte actuel, les récréations devraient se faire.
We told parents that the children will not go out of their classes during break, so they should send their children to school with cooked food. I blame some parents because they rather give money to their kids. Now they are unable to have something to eat.
Vous le voyez. Donc moi je ne sais pas, il y en a qui ont pensé que
a similar exercise has been witnessed in examination centers in Kutaba in the Nun Division. At the entrance of examination halls, mobile taps have been put at the disposal of teachers and pupils so as to ensure their safety.
Now we're going to talk about food security on the African continent. The coronavirus pandemic, drought, flood and other natural catastrophes are threatening food security seriously on the African continent. And Equinoxe takes a look at the situation in this report.
According to economic experts, Sub-Saharan Africa is facing one of its biggest famine crises in living memory. With the COVID-19 pandemic and lockdown measures coupled with the already existing floods, drought, crop devastating diseases, food supply is critically weakened, with even a bigger problem looming in the horizon. All these disastrous factors are not only hurting the current crop, but disrupt the supply of quality seeds for the future harvest. As a result, seed demand is expected to outstrip supply by nearly twice in the coming season, based on experts' opinions from 7 African countries. And as in the rest of the world, the health crisis has precipitated an economic crisis, reflecting 3 large shocks: disruption of production and a sharp reduction in demand, spillovers from a sharp deterioration in global growth and tighter financial conditions, and a severe decline in commodity prices. As a result, the region's economy is projected to contract by 1.6% this year, the worst reading on record. Experts add that the economic crisis will exacerbate social conditions and aggravate existing economic vulnerabilities, while containment measures and social distancing will inevitably jeopardize the livelihoods of countless people. Decisive measures and support from the international community are urgently needed to limit the humanitarian and economic losses and protect the vulnerable societies. The challenges for relief organizations and governments will also be to ensure availability and access to high-quality seeds for the most nutritious crops, so farmers can feed themselves and their nations Failure to do so could result in a vicious cycle of meager harvest, nutrition, and poverty.
Talking Point is up next. Our guest today, Professor Henry Famundam, is joining us from South Africa. Professor Henry Famundam is a medical expert, and he served as the Medicines Regulatory Authority in South Africa on clinical trials and pharmacovigilance committees. And you have a wide experience in training on HIV/AIDS prevention, treatment, and medication errors and regional medication use evaluation. And of course, we should also indicate that you have been part of many World Health Organization teams in different areas of your competence. Professor, welcome.
Thank you very much.
All right, we're going to start with the situation, notably in the Republic of Cameroon, as far as the coronavirus pandemic is concerned. Before we go across the continent, Cameroon is now counting more than 13,000 confirmed cases, and the death or fatality rate stands at 2.3%. What's your analysis of this?
Thank you very much for inviting me one more time. I think the issue of Cameroon, I'll probably put in a little bit of a context that this is something that we've seen being reported throughout the world, and Africa, which Cameroon, especially sub-Saharan Africa, you could see that the numbers are rising, but very, very slowly. In the US, which is a population that is probably 4.5% of the world population, they have 25% of it. That's probably because in the US, the surveillance system is excellent. It's the best surveillance system that we have in the world. And so the numbers that we have in Cameroon, 13,000, I think it's not a very true reflection. In fact, I'm going to say something which people are not expecting it. If the numbers are going up in Cameroon, it's a good sign that we're screening, we're tracing. And so what the numbers that we want going down is the fatalities. But the numbers that we want going up is the number of cases that test positive. Because right now, 13,000, I think it's an underreporting like we see in so many African countries. And so we should be doing a better job. And as far as Cameroon is concerned, one of the important things that I want to say is that people have to understand, both the government and the population, that in a pandemic that is very easily transmissible as COVID-19, you have to make sure that the government is working very closely with the population. And I think following Cameroon, I see a little bit of a disconnect. I think the government is doing a good job with the awareness. That's what they've done. But here is something that we're looking for, behavioral change. You can create awareness, but we want to make sure that within the population, there's a behavioral change in terms of making sure that they comply with the mask, the social distancing. I think we're still a little bit of a long way from that. But also with the population, it's important to know that this is a disease that it has to be addressed at the level of the community. This is where we start talking about the chiefs, about the quarter heads, about the family heads. It's not the government to come and work at that level. The government creates an enabling environment, and then the population takes over from it. So this has to work very closely together. And one of the other things which has actually been said by a number of people in different countries is the fact that it is very, COVID-19 is highly stigmatized in Cameroon. And part of the problem was the way the government handled it in the beginning, which is when somebody dies of COVID in a country that has a very strong culture of burying their dead, and people were heavily buried. And that has made a lot of people not to go to the hospitals. I understand it has been changed, but there has to be proper engagement of the stakeholders to make them understand what is the procedure when somebody dies, so that you can destigmatize it and allow people who are positive to be able to go to the hospitals. Otherwise, we're going to have a lot of people dying at home, which means transmitting to a lot more people at home.
Professor, out of the 13 or more than 13,000 confirmed cases of coronavirus recorded in Cameroon this far, more than 11,000 persons who were tested positive for coronavirus have been successfully treated, and the fatality rate stands at 2.3%. Do those figures indicate how well the government is managing the pandemic?
Well, yes, it gives them some credit. But as I told you before, I think some of the numbers are totally underreported because the surveillance system that we have in Cameroon, which is very similar to what we have in most African countries, if somebody had COVID in Kuseri, somebody has COVID in Cambe, and I'm not sure if the systems are well grounded in place, because surveillance is something that is very specialized. Most of the African countries are not very good at it. There's a lot of improvement. So I think in terms of the percentage of case fatality, that's excellent, 2-point-something%. But I'm not sure if those figures are actually very reflective of what happens in all the divisions and all the subdivisions, in all the rural areas, because our surveillance system has not been that strong. It's been improved over the years. So to that effect, we should keep it very low.
Now, on the African continent, Africa first recorded its first COVID-19 case on the 14th of February 2020, and by April 2020, the continent already had more than 10,000 cases and more than 500 deaths, and as of now, the figures have increased to 404,796, and now the total number of persons who have been successfully treated stands at 192,600 persons, and 10,147 have died so far. What do you think about the progression, the evolution of the pandemic on the continent?
Well, the pandemic on the continent, I will tell you a number of things. Let me just go back to the anecdote. In the early 80s, when HIV started, it was started in San Francisco in the US. The African countries were complacent about it, and less than a decade after that, 70% of the HIV cases that you have in the world are found in Africa. But in the beginning, it all originated from San Francisco, from the US, and then it gradually, the numbers that were being reported from Africa were extremely low, and then it just shot up, and we're now sitting with 70% of the world cases, which is about 24 million of everybody that's HIV positive is in sub-Saharan Africa out of the 35 million. So it's a very high number that we have. I am very concerned that with the population of sub-Saharan Africa of about 1.2 billion, we're still reporting close to, of the entire population of the continent is probably about 1.4 billion people. We're reporting only 400 cases. That tells me that there's something wrong with that picture. And we need to make more efforts in terms of how we're gathering data, how we're reporting. We need to be more aggressive in terms of how we do in the rural areas. In the African continent, the urban and rural divide is huge in terms of healthcare infrastructure, in terms of healthcare personnel, or on the continent in general. We have the weakest healthcare system in the whole world is found in Africa. And so some of the things is because of the leadership that we have, it's because of the healthcare financing, the human resources, the availability of commodity, the technology that we have supporting healthcare. And these are all things that need to be corrected with emergency effect, because we're now dealing with 3 major pandemics. We actually have HIV, TB, malaria, and then COVID has been added, that's number 4, and we're just hearing recently that there may be another strain of swine flu that is coming. And this is going to be very challenging for this continent. So we need to make sure that we all get very aggressive, we all get serious, and this is not something impossible that we're recommending. Cuba is a developing country, has the best healthcare system that you have of all developing countries. In fact, the healthcare system in Cuba is much better than what you have in the U.S. It has the life expectancy in Cuba is probably as high as you find in the U.S. So what we're actually recommending is not something that is impossible, and it's very important that we make sure that we begin to prepare for the next pandemic that are going to come, because, oh yes, we're going to have a few more pandemics that are going to come in the next 10 years. We're going to have serious pandemics that we'll have to deal with.
What is wrong with health governance in African countries, the governance aspect of the management of health systems in the African countries?
So when we talk about leadership and governance for healthcare delivery, we're actually referring to the government. And within the government, there are a number of things that we want to see. The commitment of the government to be able to do that. What is the percentage of the national budget that you're putting to health? And you will see that the percentage of the national budget to health is very, very small. And when you put such a percentage, you can't resolve your healthcare problems. And if most of the African countries are talking about emerging economies before 2040, you can't emerge if your population is sick, if it's not healthy. You can't emerge when your population cannot deal with pandemics. You cannot emerge if your population cannot handle chronic diseases or actually do prevention. So these are some of the challenges that we're seeing with the commitment that is coming from the various governments. Now, if you go to a well-designed country, you should have like a 5-year development plan for a national strategic health plan in the country that is known by everybody, that this is what the country is planning on immunization, is planning on healthcare prevention, is planning on managing infectious diseases, is planning on managing chronic diseases. So the population, whether you're based in Kuseri, in Kambe, you should be able to know that this is what my government is doing. And I'm afraid that we don't have that kind of stakeholder engagement. When that is developed, say in Yaoundé, for example, you should be able to go to all the regions and be able to tell them that this is the national health plan for the next 5 years in the country, so that everybody is aware of it, everybody is partnering with that. So that's very critical and very important, and it's lacking in Cameroon and many other African countries.
Professor, what explains the fact that despite the huge resources that African countries are endowed with in the face of major health challenges like the coronavirus pandemic, HIV/AIDS, and others, many African countries are depending on foreign aid?
Well, that is part of the problem. You can't have a situation where your healthcare cannot be sustainable if 70% of it is run by donor funds. The HIV program, for example, there are countries in Africa where 80% of the funding for HIV comes from donor funds. That's not sustainable. And I can tell you right now, because that's an area that I do a lot of work, and I go to many African countries. If for some reason the US says, I have a problem with the COVID-19, I can no longer help Africa for HIV/AIDS, the HIV/AIDS management on this continent is going to collapse overnight. And so it's never a brilliant idea for you to be dependent. And there are various ways that we can raise funding for healthcare on this continent. The taxes that we put on cigarette smoking, for example, is the lowest compared to what you have in Europe. In most African countries, tax cigarette sales in order to add to the healthcare, because it actually makes your insurance to go up, because the insurance companies know that people who smoke, they invariably come down with a lot of other diseases. And in some countries, they also get funding from taxing the alcohol sales, because they also know that alcohol contributes to healthcare negatively. And so African countries have to find a way to be able to make sure that they're raising adequate funding rather than over-dependent on donor funds, because that's not sustainable, and this continent is going to continue lagging behind, and the next pandemics that are going to come, we're still going to be running around like we're doing now.
What is the impact of the fact that many African countries, the health systems, the financial aspect of the health systems of many African countries are over-dependent on foreign aid and poor governance on the human resource aspect of the health systems in African country?
Well, on the human resource system, Jonathan, that's a very good question. A lot of people have tried to compare it with even slavery. You know, this continent has the least number of doctors, the least number of pharmacists, the least number of nurses, yet we have the developed countries, the US, Australia, European countries. This is where they come to poach for doctors, for pharmacists, and nurses. And so the ratio that we have is very, very poor. Now, take for example, let me give you a good example. WHO recommends that it is one pharmacist should be able to take care of 2,300 patients. In Malawi, for example, it is one pharmacist to 450,000 patients. That is going to be inefficient. You can't get anything out of that kind of ratio. And so we have a continent where the doctor to patient ratio is just overwhelming. And so you can't get quality care. After having said that, there are a couple of measures that Africa needs to start thinking about it. There's what we call task shifting, which means we have to start getting our nurses to do more. We have to start getting pharmacy technicians to do more. That's one of the solutions that we have, because you cannot stop people from moving. So you need to also be able to give them incentives, which means if we have to pay them more, then we have to pay them more. We also have a bigger problem in Africa where you have the rural-urban divide. That's why you have everybody in the rural area moving into Yaoundé, moving into Douala, moving into the cities. Those cities were never designed to absorb such a population. Most of them move not only because of jobs, also because of health care. Because if you go to the rural areas, you can't have proper health care. So what do the people do? They move. And so these are issues that we have that we must sit down and be able to address, because you cannot have quality health care. You cannot have proper treatment outcomes if you don't even have enough doctors, enough nurses, enough pharmacists. And in some countries, they're beginning to train a lower cadre. They train more nursing assistants, they train more physician assistants who are like clinical officers, so that they cannot be poached to the US, to Australia, to Europe. Because you just can't stop them, because it's also attached to human rights. So what some countries are also doing is signing contracts with them. And so, in summary, the African countries use their resources, because most medical schools, for example, are subsidized by the government. When the people graduate, then they leave the country. If you go to some countries like Zimbabwe, like Ghana, you could see in a stretch of about 10 years, about 80% of the doctors that were graduated from there have left. And so, what kind of output do you expect?
All right, Professor Henry Fomundam, health expert, joining us there from South Africa. Thanks so much for being with us today. Goodbye.